NextGenWeb is joined by a longtime friend and contributor, Dr. Jay Sanders, President and CEO of the Johns Hopkins Global Telemedicine Group. And Dr. Sanders, as always, we really appreciate your time.
Thank you.
Just wrapped up the panel here at the Center for Connected Health Symposium titled The Futurists. You started out, as always, with a bit of humor. You cited the completion of your first telemedicine study back in 1976, and you said that when asked by a reporter at that time how long it would take to integrate those things into the healthcare delivery system, you unequivocally said 3 to 5 years. Well, here we are in 2009. What gives? What's the challenge in getting some of these applications into the system?
Well, I think the biggest issue in 1976, and the reason it didn't happen, probably some of those issues still remain today, but one of those issues was telecommunication infrastructure. And I think today we're beginning to address it. But I think the continuous hurdle remains reimbursement for these very effective, very efficient services. For some reason, and particularly the federal government has not found it in their wisdom to provide reimbursement for the care that is being provided to people who are either geographically or socioeconomically isolated. One simple way to resolve the entire issue is for them to define medical care by what is done, not where it is done. So if I deliver a telemedicine consultation in the inner city, that ought to be reimbursed in the same way that I deliver a telemedicine consultation in a rural community. So I think reimbursement still remains the critical issue.
Right. You talked about disruptive applications among ordinary technology. So I think gets to some of the care issues you were just talking about. What does that mean, and can you give a couple of examples?
Well, sure. I think we've got the technology. Just look at the smartphone. Just look at the iPhone as an example. I can now use that iPhone to do a physical exam on a patient by plugging in an ultrasound probe into my iPhone. I can look up any medication that I have with a downloadable software called Hippocrates. If I don't feel well, I can use a downloadable software called iTriage, and in fact, it will take me through my symptomatology and give me a suggested diagnosis. And some of the new software that has come out allows a radiologist to literally read an MRI or CAT scan on their iPhone, or they can attach an adapter to their camera and it converts it into a microscope so I can look at a blood smear. I basically have in a smartphone my electronic black bag.
Well, one thing we know for sure is that we'll probably be talking about these things again at next year's symposium, and as always, we appreciate your time.
Thank you, Fred.